us move on right now to our next discussion, where we will be looking more closely at the state of healthcare infrastructure. The fact is, South Africa does not have enough hospitals and clinics where patients can go to seek treatment. Another fact is that many established facilities do lack sufficient medical supplies and staff, and are also in need of major upgrades and maintenance. And the last unfortunate fact about the state of healthcare and the healthcare infrastructure at this point is that historic investments into the space, most notably by the public sector, have not yet yielded the desired results. This next panel will then explore what needs to be done to strengthen the existing systems and structures here in South Africa. And these are your panelists.
Dr. Shakira Chinara, African Union Youth Advisory Council. Dr. Lenias Wenda, founder and CEO of Medicines Africa. Quinton Zunga, CEO of RH Bopelo.
Thank you so much to the panelists for joining us. And Dr. Chinara, I'd like to begin with you, because when we are talking about resourcing for the future needs of our healthcare system, I'd like to know from you where you think the biggest opportunity in this space currently lies.
So, it's great to check in with everyone. And I think that I'd like to talk about three main strategies and where the opportunities for this lie. And the first one will be the human resources for health strategy. And I think we don't have to talk about additional resources. I think we need to talk about the 133 billion rands which was spent in 2019 or so on healthcare professionals. And so we are really investing quite a bit. Why are we not seeing the returns that we want to see on healthcare worker satisfaction, on patient satisfaction as well? And within this health budget, 25 years into democracy, after so many commitments, why are we still failing on infrastructure? We then, sort of shift over to the digital health strategy. And I think that's very exciting for some of the infrastructure commitments that government is making between 2019 and 2024. And some of it is around patient data. And I think a key opportunity for us to think about is we don't just collect data so that we as healthcare professionals can look at it. It's important for patients to be able to understand their data, to access their data, to be able to be referred to other parts of the health system and to use their data. Then, of course, the opportunity within both the digital health strategy in South Africa and within the NHI is that there will be a focus on the supply side of the health system. And that's very important. The financing mechanisms, the procurement, and that's really the opportunities we have and the infrastructure we've got to have at the very basis of it. Because, for example, I focused my PhD on the financial level of the health system and at the lowest level, the district level. And it was shocking to see in South Africa that finance managers didn't have proper laptops or computers or even internet connectivity to be able to process procurement requests or do their budgets. So I think that, we've got to look at some of the gaps, but then also how do we address this?
Mm-hmm. Quinton, to you as well. I mean, good evening, and really great to catch up with you. Where are you seeing the gaps in the healthcare infrastructure space right now? Because what was quite prevalent throughout the COVID-19 fight, if I can put it that way, and particularly at the onset of the virus here in South Africa, was the fact that as well resourced as our private sector is, even the private sector was under pressure in terms of the number of beds and the number of patients that could be seen as a result of the pandemic really catching a lot of individuals off guard. So for you, the state of South Africa's healthcare infrastructure space, as you see it, and where the opportunities or low-hanging fruits to ramp up or improve the area currently lies?
Thank you, Fifi. I think the opportunity for the country is to invest in the middle section of healthcare infrastructure. And the key thing that we need to realize is the current structure of private healthcare covers only 20% of the population, about. And the public sector, which was never meant to cover such a large portion, covers 80%. And what's happened in the last 20 years is there hasn't been much investment in the middle income infrastructure that allows the government that takes off the burden from the government and allows a differentiated service for the private sector. So what you have now is private sector is OECD country quality, and public sector is subpar third world quality, very expensive private sector and overcrowded public sector. So the infrastructure that's needed to alleviate this pressure is the middle infrastructure. This is affordable healthcare, better networked clinics with better triage. I mean, right now you have the situation where if you have hypertension, which is your blood pressure is high, you're going to go into the same hospital with someone who just had a heart transplant. It's completely the wrong utilization of resources, and that leads to quite a disconnect in outcomes, because the cost of that care versus the need in terms of the acuity does not match. And that's where the opportunity we think as a company and as a country that we need to invest in the middle section, and that section will cover about 25% of the population, which we think will allow the government to service about half of the population and alleviate pressure in terms of facilities.
All right, all right. I'll probably be a bit further on that in just a moment, but just to get some opening remarks from Dr. Linnea and your view on, the existing system and the structure and how it impacts organizations like yours that try to provide a quality health care for quite a number of people at a cost that they can afford. If you could just kindly unmute so we can hear your response.
Thank you, Fifi. Can you hear me now?
Loud and clear. You can fire away.
Yes. So, the last mile, where most of our people are in the villages, that is one of the most neglected areas, not only in South Africa, but all over the entire region. It is difficult for people there to access health facilities, which are the primary level where, you need people to be able to access in order to be able to detect illness, to prevent illness, and to provide healthcare services. It is also the level that is most neglected when it comes to providing treatments that you need to be able to manage disease well. In the case of COVID, for example, we have, as African countries, we've experienced quite a significant challenge accessing diagnostics, PPE, and all the health products that are needed to manage the pandemic effectively all over the continent. So I think there is a big opportunity for us to invest in developing supply chain infrastructure that allows us to bring treatments and health products to people in the last mile, which are the most difficult people to reach, like Quentin just explained, but also to have the health facilities, where people can actually go to be able to get diagnosis, to get treatment, to get preventive services.
Mm-hmm. Quentin, if I can just come back to you then for just a moment in your thoughts on adding on, the last mile and perhaps how we better model our health system in future so that the correct patients are treated in the correct hospitals, and we've got further investments into that middle section as you did highlight. What kind of investments is a player like RH Bophelo? You are listed on the JSC, so presumably you have a lot more firepower than some some of the SMEs that we were speaking to previously, but what kind of investments are you thinking of making in this space? What kind of perhaps talks are you having with government on this regard? If you could just unmute yourself so we could hear you.
Oh, yeah. Yeah, we are investing in what we call affordable and efficient entry-level hospitals. Now, generally, when you think of a hospital, you think every hospital is the same. It's not. Now, we think we want to bring down the cost of healthcare infrastructure build, because that's where the problem starts. How do you bring that cost of infrastructure? Currently, the private sector is bringing healthcare at around 2.5 million to 3 million rand a bed. The government is bringing on infrastructure at about 5 to 7.5 million rand a bed. We think the actual entry point for this infrastructure is 1 million rand a bed. So our infrastructure that we want to put for the entry-level hospitals, and entry-level hospitals are basic 50 to 75 bed hospitals located in the population zone close to the people, where you don't have to travel 100 kilometers, 20 kilometers, it is there. And then that hospital triages you when they realize or when they are certain that your acuity is much higher. So only high-end patients go to the tertiary and quaternary hospitals. So our investment and our capital base is setting up a network of 150 of these hospitals in the country, close to the population, to make sure that when you need healthcare, you have an affordable entry point. And this is not novel. I mean, it's been done for banks, it's been done for there's a shopping center with a supermarket close to everyone now. But somehow, because we have not focused on efficient healthcare infrastructure, healthcare is lagging behind, and everybody who can't fix the affordable is pushing that pressure to the government. The government is buckling and the system is crumbling. So for us, the entry-level hospital is key, and it'll give us better access to people, better diagnostic, better early treatment, and better data to share with the country.
Okay, so staying with the healthcare infrastructure, right? And, you know, just as you have highlighted, Quinton, I mean, the amount of focus that needs to be put into the space, and the other panelists have done the same. But of course, you need people to be working once you, in these hospitals and clinics, once you do get the infrastructure mixed right. And the majority of these people will be young people, given that they are our most valuable resource at the moment. But they are also feeling the stress, and they're also feeling the burden of being overworked and being burnt out. And Dr. Shinara, I'd like your insights then here, because you did mention your excitement around the digital health strategy that government has put forward, but just your views on how we can get a lot more young people to be a part of that strategy, and perhaps stop some of the hemorrhaging of young talent that we're currently facing as a result of young people just being too overworked.
So I think, I'd start off reflecting a little bit on the public sector a lot more, because I think we're doing quite well in the private sector. But again, as one of the other panelists said, we have this big divide. We have about 7 specialists per 100,000 in the public sector, and we have about 69 specialists per 100,000 in the private sector. So you can see the divide there. And the big question is, in the public sector, why are you not seeing a range of health professionals? And I think it's important for us to talk about health professionals holistically, from the dentist to the pharmacist to the community health associates, etc. And what we find in South Africa that I think is quite interesting, we need to consider within satisfaction of health workers, is these different categories. Because the Human Resources for Health strategy shows us that over 56% of the workforce are actually nurses in South Africa. A new emerging really category of health workers are 22% community health workers. And so we need to look at, when we're talking about frustrations and when we're talking about interventions, we need to consider very targeted efforts, I believe. But I think, when I just reflect very, very realistically and practically of what's going on, as a young health professional in whatever field you're in, and I work in public health, but I mean, for example, just to really enter the health workforce in South Africa is frustrating. Your processes are bureaucratic. Your applications either get lost or never answered, and that makes you wonder. So that's your first barrier as a healthcare professional in South Africa wanting to enter the workforce. Once you do, you're then surrounded, if you're at a policy level, again, you're surrounded by immense bureaucracy. You're surrounded by the youth voice not coming out very strongly, or the space for the youth voice. If you're working at the frontline level, what you're finding is that, and as you said, Fifi, when you started off, our facilities are filthy or dirty. We don't have the technology to do what we need to do. We don't have the infrastructure. And so it's difficult to practice and really operate at the front line. And what we've seen during COVID-19 is that, several healthcare workers felt the pressure. They weren't protected. They didn't receive the PPE. And all of these factors essentially contribute to younger health professionals being extremely frustrated within the system. But what I was quite excited to find throughout the evening, and I think it came out in the Future Health report, was that the ability to have a smart hospital, so similar to our private hospitals, leads to health worker satisfaction and young health worker satisfaction. Because at the end of the day, we are millennials, and we are meant to operate in a system which is extremely outdated. And this is something that government needs to consider.
Certainly, I mean, as Romulan did highlight that the report actually found that young people are equating, hospitals and healthcare facilities that use technology more strongly, the same as, work-life balance, and that is impacting on their decisions to stay in that space. Quinton, just your view there on the youth and young professionals. As Dr. Shinara did say that, I mean, in the private sector, perhaps some of the challenges facing the youth in terms of, workload and stress and, not sufficient medical supplies are not as acute in the private sector. But nonetheless, what the report also does highlight is the fact that young people are not necessarily feeling as empowered as they should be. And I just want to know your thinking and your strategy of empowering the youth and getting them more involved in directing the future of healthcare, perhaps the future of RH Bophelo specifically.
So we've got an interesting dilemma in that the resources that are needed to power the next level of healthcare are still in the works. What do we have currently? We have a shortage of hospital managers. We have a shortage of hospital finance managers. We have a shortage of theater nurses. We have a shortage of unit managers. And unfortunately, all that skill needs to be transferred to the youth. But the situation we have is that the transformation institutions are not coping. So right now, most of the nursing colleges are closed. It's completely, doesn't make any sense, but that's where we are. They are closed, so we are not generating new people. And now the scarce resources we have are requiring more and more remuneration beyond the affordable range. So we as a company have been trying to train new staff, appoint new staff, and give them training, but it is a process. And what we really need is the younger professionals to have the tenacity and the longevity needed to acquire the skills, because a lot of them are coming out of the schools and they've never operated the finances of a hospital. They've never dealt with the switching of medical claims. And it's completely not their fault, but we as a country and us as a company, we need to continue to invest in the youth to acquire these skills to be so that we can spread them across the country. Because if you have these shortages in cities, imagine the shortage in rural hospitals. It's even more acute. And we really need to focus on what is there. The funny thing is that we know what's in short supply, but we just seem to not be able to all come to agreement as to how to generate these skills in the right supply that makes affordable healthcare a reality.
Dr. Elenea, do you perhaps have any views on how we do get this skills transfer system working a lot more? Any comments on the dilemma that Quinton has, of course, presented, in the fact that, yes, these young people do need skills upliftment, and particularly non-clinical skills upliftment, but the people that should be doing that and transferring those skills are not necessarily there, which aggravates, or which is aggravating the problem a lot more.
Absolutely. Health workforce shortages are one of the biggest challenges that we are facing, not only in South Africa, but in countries all over the region. And I think there is a huge opportunity going forward, like the minister talked about, in order to achieve resilience of our health systems and health infrastructure in the future. I think technology here can play a big role in terms of educating and appropriately skilling those health workers, the experts themselves that are involved in higher level care, and from the primary level going up on the health system. So I think technology, through e-platforms for learning, for transferring skills, even through telemedicine, where you could have health facilities. Somebody mentioned that the largest proportion of the people providing care are nurses. So you could bridge that skills gap by having clinics that are manned by nurses, by health workers, but connecting to higher level experts who can provide support in terms of diagnosing whatever issues the people are presenting with at the primary care level, at the intermediate level, and providing referrals and consultations, being guided as needed. So I think that's a huge opportunity that can help improve the resilience of health systems going forward, but also to reduce the cost of the investment that is required to actually build the physical infrastructure that is needed to provide healthcare services. You could use investment in technology, in mHealth, in managing the documentation for patients, in providing actual services through technology. That's a huge opportunity.
In terms of these shortfalls, perhaps in our healthcare system, if we can just stay on it for just a moment further. So far, particularly as we focus on the subject of skills, it would seem like it is a capacity problem. And I'm just wondering to what degree the panel does feel that there is an element of capability as also being a challenge in terms of being a shortfall in our health system. And Dr. Shinara, any views here? Capacity versus capability, which is it for you?
Sometimes I don't like to say that people don't have the capacity, because I think everyone has the capacity. But I think what needs to happen is a mix of a transfer of skill, and my fellow panelists spoke about it. So what you find in typical health related degrees or disciplines is that you fail to learn about the bigger world, which is gross domestic product, how to do investments. And one example comes to mind. In my first year at medical school, there was a question about GDP, and no one in the class actually knew that. And so, learning elements of sociology, for example, understanding patients, because sometimes also the workload is so high. And so you'll find that many medics would just try to get through the different patients. But what you're failing to understand, for example, is also the circumstances someone is living under. Someone with HIV, do they have a job? Are they getting nutrition? So just giving the ARVs is not the answer. So there's a mix of interdisciplinary skills that one has to learn, or absolutely has to learn. I think in terms of capacity, what's missing is that things are outdated. Like I said, the health system is outdated. So are many curriculums around the world. They focus primarily on the way things are being done. We're seeing a little bit of a shift into digital health, and that's exciting. And then finally, what I also found working at the district levels is that the supply side, so the procurement and the finance staff, wouldn't understand the medical side. But what you'd also find, like the panelist said, the fellow panelist said, is that the health side or the medical side doesn't have an understanding of project management, etc. And how do we build those skills? I think that's the question. It can be formally through university education, but in one of the districts I actually worked with on the West Rand in Gauteng, the district manager would actually throw finance staff into nursing meetings and nursing staff into finance meetings. So we can also provide on-the-job learning. And that should also be a critical part of what we do. So I think, yes, certain skills are missing, but I don't think it's a train smash. It's about us thinking a little bit smartly of how to build these skills and how to do so in a manner that's either formal or informal and on the job.
Okay. The view of the panel on NHI, I mean, it has been in the pipeline for some time, and all over the world, the economies are trying to improve equitable access to healthcare for its citizenry. Quinton, perhaps, from you, the fact that our healthcare needs to be revamped, of course, is not something that needs to, that is debatable. I suppose that's something that we all agree on at this moment. But NHI, and as a private sector player, will you be getting involved perhaps with the government on forging ahead with this? Any public-private partnerships that you see in the offing here?
Absolutely, Fifi. The NHI for us is a huge opportunity. Why? NHI is a payer system, and we are an infrastructure company. And an infrastructure company, a payer system, needs an infrastructure to deliver the healthcare at an affordable rate. So we believe our suite of facilities are well positioned for NHI, because we will be able to provide them at a very competitive rate, because we're bringing on the infrastructure at an affordable cost. So we think NHI could definitely change the paradigm. We may have slight adjustments we feel that may be necessary. For instance, should NHI cover everyone on a mandatory basis? I mean, these are all payer issues related to choices, and we think that choice must be allowed in some form of fashion. But at the core of it, we think NHI will work better with affordable infrastructure. And what we know for sure is that the government has been putting on infrastructure at a much more expensive rate than the private sector. And our goal is to produce the really, really low cost entry hospital. Look at it like your takeaway at the corner. Those are modularized entry, simple. They'll put it up in 6 months. It's there, it works, and it's good. That's what we want to do to healthcare in South Africa, and we think it will stand in good stead for NHI. So we are a very big NHI proponent. We are NHI ready. We have already started working with the government in terms of best modalities, and obviously a lot of work still needs to be done, but we're looking forward to it, and we think it will help the population in attaining universal health care.
All right. Just getting into some closing comments now then from the panel. And Dr. Lenaya, just to begin with you, I mean, this is the Future of Health Summit, and I would like to get your thoughts on the future of health here in South Africa as you see it today.
Well, I think the future is going to have to be, we're going to have to think about building resilience, doing all the things that we need to do to build, to improve the resilience of health systems, of health infrastructure. So that means having adequate health workforce, an adequate health force that is appropriately skilled to be able to support treatment and care services up to the, from the last mile up to the highest level, having the higher level of expertise that is also needed to provide quality care. And then that also means investing in improving supply chains to be able to source cost effectively the medical products that are needed for South Africa to be able to run effective treatment programs, interventions at all levels of healthcare, ensuring that people are provided for. And of course, the coverage, the coverage of the cost of care through the NIH is very critical, because in a lot of places, the need for patients to pay for healthcare out of pocket is one of the biggest limitations to access to healthcare, access to treatment by patients. So when a government like South Africa is able to cover that cost so that patients don't have to pay out of pocket at the point of care, that is going to improve the resilience of that system enormously. And we've seen this in other countries. And of course, yeah, okay, I'll stop there.
All right, thank you. Unfortunately, this conversation has run away, and we are shortly running out of time. If I could just get the final thoughts from the last two panelists. Dr. Shinaria, just to begin with you then, the future of health in South Africa as you see it today, if we could just keep it brief.
3 quick points. I would say that the NHI is the right speak, but implementation is really what we have to focus on, and there's critical aspects missing. The second one is, as a young person, I want to reimagine the health system. I want to see an overhaul, different health system in many years to come. And the final thing that gets me very excited, both from the Future Health Report and throughout today's discussion, is the term smart dividend. And I think that's incredible as we go forward.
Quinton?
I agree with all the panelists. We are focused on efficient and affordable infrastructure overlaid with technology, digital health, overlaid with financial services, and integrating the three. Your healthcare should not be a burden, but an efficient purchase of effective healthcare. And I do think Africa has an opportunity to define a different models, just like India, just like some of other developing countries which have affordable healthcare. And the opportunity for us is now.
Well, of course, the opportunity is now, and I agree with you there wholeheartedly, Quinton. But thanks so much to the panelists for your insights and the contributions that you have given us to surely think about what we should be doing to strengthen the healthcare system in the immediate future. Of course, I was in conversation with Dr. Shakira Shinaria, who is a research and advocacy specialist in public health, Quinton Zunga, who is the CEO of RH Bophelo, and Lenaya Wenda, the founder and CEO of Medicines for Africa. And this does bring us to the end of the Future of Health Summit, day one of the Future of Health Summit. And we're going to do it again tomorrow, where we will be fleshing out some topics that will include plugging the gaps in health care education and also training, as well as creating a healthy workplace environment that is devoid of some of the stresses that are causing young professionals to burn out and exit the industry prematurely. I do look forward to seeing you all again tomorrow, and thank you so much for being a great and engaging audience. Until then, goodbye.